I'm honored to introduce our special guest today, Colleen Jorgensen, on the topic of Discover to Recover, osteopathy and yoga therapy for pain care. J'aimerais souhaiter la bienvenue aujourd'hui à Colleen Jorgensen, I probably didn't say it right, sorry, sur le sujet Découvrir pour récupérer, ostéopathie et thérapie de yoga pour les soins de la douleur. Colleen is accomplished in the fields of osteopathy, therapeutic yoga, Pilates, and somatics and pain care education. She holds, elle détient, an exercise science degree with a specialization in athletic therapy from Concordia University, a diploma of osteopathy from le Collège d'études ostéopathiques de Montréal. She is a certified Polo Star Pilates instructor and educator, and a certified Hatha restorative, gentle, somatic, and pain care yoga teacher, and teaches anatomy for Pilates and yoga teacher training programs. She's had over 20 years experience as an athletic therapist, osteopath, and movement teacher. Colleen has over 1,500 hours of continuing education and always enjoys learning more. She was the proud owner of an osteopathic clinic and Pilates studio, Core Basics, for over 16 years. She had to close her clinic studio suddenly in 2013 due to health issues, but reopened a smaller home practice, Stillness in Motion, where she continues to practice today. The last 10 years, she has been passionately doing the research and the work to create Discover to Recover, an online pain care program that she hopes to launch in the next couple of months. So welcome, Colleen. Thank you for taking this time to be with us.
Thank you so much, Sandy. Thank
So
you
Colleen,
for having me, and thank you all for your patience today. Well, I lost you, Sandy, but I think you're inviting me to do the practice.
exactly.
So I thought we would start right away by getting into our bodies. Perfect. Especially after the little mishap we had getting here. It's a perfect example of when you can use this type of practice. It's very simple and easy. You can do it anywhere. And it quickly brings us into our parasympathetic state, which is the one that we think of as our rest, digest, and repair state. So whatever position you're in is fine. You don't need to change positions. If you're like me and you've got, you're wearing earphones, I'll tell you a different way to do the practice because it involves the ears, okay? So I'm gonna take one of mine out to show you. So you guys are gonna do both ears at the same time. You're going to hook your index fingers like so, and you're going to place one finger right at the cartilage at the bottom of the ear. If you're wearing a headset, you're just gonna go on the front of that cartilage of the ear instead. And with your thumb, you pinch behind. So it's the cartilage of the ears between thumb and index finger, okay? On both sides. From there, you're going to gently traction the ears away from the head. So you might feel a slight stretch. You might feel an opening. You might feel that all of a sudden you could breathe through the nose a little bit easier. And you're gonna maintain that the entire time, okay? From here, we very slowly nod the head forward and back like we're saying yes. It's better if the eyes are closed. You don't need to see me. I'll cue you with my words. So gently nodding your head up and down like you're saying yes. Pause in the center. You're still keeping that traction at the ears. You're gonna now shake your head side to side like you're saying no. And the trick is that the hands don't follow. You wanna keep that slight stretch between your fingers as the head does the movement. Pause in the middle. And then lastly, it's as though your tip of your nose is the tip of a pencil, and you're going to trace a toonie-sized circle on the wall in front of you. Let's go for 3 times clockwise and 3 times counterclockwise. When you're done, gently open the eyes and very slowly release that hold you have on the ears. And we're ready to go. Our vagus system is nice and now, and we're ready to take in some information.
So Colleen, your image is frozen, but we can hear
Send it
you.
back to you, Sandy.
Yeah. So Colleen, your
So
image
is yours.
is it? Yeah. So
Okay.
okay.
Oh,
All right.
there you are.
Here we are. Perfect. All right. So thank you for that. So we're going to ask some questions to better understand the world of osteopathy and yoga therapy for pain care. So when did you start developing an interest in these fields, Colleen? Oh, I think she's left and she's going to come back. Oh, there you are.
I'm back.
Colleen?
Sorry about that. I got kicked out.
That's
Okay.
okay.
Hopefully we'll get a good roll. Can you hear me?
Yes, we can hear
Hear
you.
me okay, Sandy?
Yes, yes, we can hear you. Your face is
Okay.
frozen, but your beautiful face is still there. All right, so we were starting the question, which is, when did you start developing an interest in these fields? I think we're still having tech. We can't hear you, Colleen.
You can?
No, we do now.
Cannot. Okay.
We're having.
So I was saying that it was a winding path. Are you with me?
Yes.
Yeah.
Yes.
I always thought that I would be a surgeon because I thought that they were the ones who knew the most about the body, and that's what I wanted to do. And then when I was 17, I had a back injury. And for 5 years, I lived in chronic pain that ended up in a spine surgery. So when I was a patient in the system, I realized that it was actually the athletic therapist, physiotherapist, and the osteopaths that I had a relationship with. They were the ones that were a real part of getting me back to what I love to do in life. So as much as I was so grateful to my surgeon, it made me realize that in terms of a career path, I wanted to do what they were doing. I wanted that relationship with my patients. So I ended up going into athletic therapy for university, had my surgery in my first year of university. And then in my rehab, my athletic therapy mentor was studying osteopathy. And I thought I knew so much about the body, which is funny to me now because I was really only at the very beginning of this long journey. And I was fascinated by how much he knew over and above what I was already learning. And the way he spoke about anatomy was not as separate parts, which was how I learned it in athletic therapy, but he spoke about anatomy as one unified whole. And so I decided right then and there that when I graduated from athletic therapy, I would start the osteopathy program, which I did. And in the summer in between those two things, which again was about now 1 year after my surgery, I stumbled into Pilates, did a mentorship where for a year I was going in 6 times a week to basically work out on the Pilates equipment to learn the repertoire. And it was amazing how much better I got through the Pilates than I had gotten previously with all the other therapies I was doing. So I started to incorporate Pilates rehab into my treatments, and that's kind of how I got here.
Okay, thank you. So is osteopathy the same as chiropractor or physiotherapy?
It's not, and it's a question that I get often, and it's ironic because I am an osteopath, but it's such a difficult thing to describe. I'm not a chiropractor or a physio, so I'm not the best person to describe those practices, but I will give you broad strokes about what the differences are. So chiropractors tend to specialize in osteoarticular adjustments. Having said that, there are many who also do soft tissue work. Physiotherapists specialize in musculoskeletal issues, cardiovascular issues, neurological issues, and some of them do the courses to also do osteoarticular work. Where osteopathy is a little bit different is, so we do those specialties as well, and then we also go into craniosacral therapy, visceral work, the endocrine system, and the fluid system. And probably the biggest difference is that rather than looking at the symptoms and trying to fix a problem, osteopathy is all about tapping into the inherent ability to heal that we all have inside of us and trying to give as much power to that inherent ability as possible. So rather than looking to fix problems, we're looking at how can we support the system so that the system has as much strength and resiliency as possible. Does that make sense? Does that clarify it a little bit?
Yes, yes, definitely. So, why should we try osteopathy and especially therapy or yoga for pain care? That is something that'd be very, yeah. Okay. So, how could we find the right
So
osteopath for us?
there are a lot of similarities between osteopathy and yoga therapy. A couple of things. You have to make sure that it's someone who's got an official degree. So you want to look for that, that degree on their wall. That's important. But you could have someone who's technically fabulous in any of these professions, physiotherapy, athletic therapy, osteopathy. But to me, one of the most important parts is that you have a good connection with that person. There's something that we call a therapeutic alliance that happens between two people. It's really a relationship between therapist and client. So even if the person you find is technically highly skilled, if you're not comfortable in their presence for whatever reason, then I would suggest to you that you look for someone who's better suited to your needs. So I often have people who've seen me for years and they absolutely want me to see their husband. And then after years, they finally get their husband to come. And for whatever reason, it's not always the right fit. And I would prefer that they find someone who is the better fit for them, because that makes a difference in your therapy. We understand now that it's not just about what's happening in the body, everything about us, our state of mind, our emotional state, our psychological state, our environment, our culture, our familial situation, all of that plays a role in our health and in our pain. So you do well to find the right person for you.
Thank you. So, what would be the effective methods for adapting a yoga for patients with cancer?
So it's a very broad question, and I can't answer it too specifically because everybody's situation is unique. But I'll say a couple of things. So, so your question was about yoga or osteo, or
Well,
both?
you could be both, yes.
Okay. Let me address the yoga therapy aspect. So there's a difference, first of all, between yoga and yoga therapy. Let me just talk a little bit about yoga on its own first. So here in the West, when we think of yoga, we tend to think of the physical practice of yoga, and that is a part of it, but it's actually only one part of what we call the 8 limbs of yoga. So the other limbs are the yamas and niyamas, which are like ethical social practices that are about how to live a life ethically and morally. There's dhyana, which is meditation. There's pranayama, which is breath practice.
Okay.
There's dharana, which is a withdrawal of the senses so that you're trying to bring everything inward instead of being distracted by the outside. Right. Asana is the one that we tend to know best, the physical practice, the postures of yoga. So is yoga therapy or yoga safe when you're dealing with something like cancer? Yes, no, and maybe. It depends on your situation. You have to check with your doctor for sure. You have to find the right person for you. There may be a time in your treatment where the physical practice is not the right answer, but then you have all those other 7 limbs that would be fantastic. And those 7 limbs get you ready to understand when, where, and how to start incorporating the physical practice. So the more that we understand how our own bodies work, the more able you are to decide if someone's teaching you a physical practice, for example, if it doesn't feel right in your body, you want to have the confidence and the awareness to say, oh, you know what, I'm not sure that this is the right for me. And
Okay.
you discuss with your person and adapt accordingly.
Okay, good. And so osteopathy, can it be performed for any stages of cancer?
Yes, it can. And it's highly effective for many different stages. What it's best for is helping with the side effects from living with cancer, from the treatments of living with cancer. So it's helpful dealing with the pain, the nausea, the brain fog, the anxiety, the depression, the muscle tension, the neurological symptoms, the visual and auditory disturbances, all of these is excellent for. We don't treat the cancer itself, but what we do is we treat the whole body, the whole person, to make this as possible so that you have as much power and vitality to fight the cancer for one, but then to also try to decrease the symptoms that are a side effect from the treatments. But osteopathy can be very, very gentle. Sometimes it's so gentle, it's a joke often between osteopath and patient, that sometimes you'll be on the table and you'll wonder if I've fallen asleep because the treatment is so gentle that you question, is she actually doing anything right now? So yes, it is safe at all stages. Having said that though, you again have to make sure that you're working with the right person. It's not every osteopath that has the awareness to work with someone who's living with cancer. So you do want to make sure that you do your homework and don't be shy to pose the questions to your osteopath and find out if they have the experience of working with someone who's lived with cancer.
Thank you, Colleen. Is it beneficial to have an osteo treatment before when you have chemotherapy, or is it better after?
Oh, that's a great question. There's pros to both, actually. So the benefit of having a session beforehand is that we can boost the strength of the system so that you're better able to handle what's coming in through the chemo or radiation treatments. And then it's good after to deal with any side effects that you might be having from the actual treatments. That's a great question.
Okay. And I guess after the treatment, you'd wait maybe the day after, or would it be 2 or 3 days?
So it's quite individual. You know, some people are so exhausted in the first couple of days after that just leaving the house to come for treatment is a challenge. So that's up to you. But it can really help so much with the, like I said, all the things that I listed, especially that nausea that can be so debilitating. So if you're able to physically displace yourself, you can absolutely come the next day, but you have to weigh that out. You know, rest is equally as important as getting a treatment sometimes. So if your instincts are telling you, you know what, today I just need to lie down and rest, then I would say listen to that. But if you have the energy to get up and get yourself, displace yourself to go to treatment, it can be very helpful with those symptoms that are so challenging after treatment.
Exactly, because you can have them during your treatments, but especially you can have those side effects for a long period of time. You may keep it all the time. So it is beneficial, like you say, to continue the osteopathy, or also to have great yoga therapy movements to control chronic pain. So definitely people can have a lot of chronic pain or persistent pain. And how could we define which one is? You know, is there any?
So we've. Oh, I lost you there for a second, Sandy.
Yes, we did. Yes.
Can you repeat? I didn't hear what you said.
I said, so when we were talking about pain, because people can have side effects of the treatments and have persistent pain or chronic pain. And sometimes it's difficult to define it, which is, and how to decrease that pain. There must be some effective movements for yoga to do that. Is there? Yeah.
Yes. Okay. So let me tackle a couple of issues, a couple of pieces in there. So when you ask about how to define chronic pain, it's actually an ever-changing definition right now. As we've learned more about pain in the last 10, probably now more like 15 years than we had in the previous 100 years. So it's really an explosive industry right now in the world of research, which is exciting, but information is changing constantly. So I'm going to read you the definition from the International Association for the Study of Pain, but then I'm going to tweak it a little bit. So the official definition of chronic pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. So it's an accurate definition, but for any of you who might be living in pain, I'm sure that doesn't really encompass what you're living. One of the issues is that our language kind of restricts our ability to properly put into words what people who are living in chronic pain are dealing with. So we used to think that chronic pain was pain that lasted past a certain time period. If it was that lasted longer than 3 months, we would refer to that as chronic pain. It's much more complex than that, we realize now. Now we understand that chronic pain is any pain that has persisted beyond the point where tissue healing should technically have happened. So in a normal situation, let's say we have an injury or an intervention like a surgery or a treatment or a cancer, you have that incident, you get the pain. As you start to heal, the pain comes down. That's the normal progression of things. What often happens is you have the incident, you have the pain, and then as you start to heal, the pain actually goes up instead of going down. What we understand now is that the nervous system is a really big part of this. The nervous system is really our alarm system in our bodies. It's responsible for being on the lookout for anything that might be dangerous. And one of its ways of warning us that there might be danger around us is to give us the experience of pain. It's the nervous system's way of tapping you on the shoulder and saying, hey, pay attention, something's going on that you need to be aware of. The tricky part is it doesn't tell us what the problem is or how severe the problem is. And sometimes it's not even right about the fact that there is a problem, which I'll come back to in a second. A really good way to think about it is if you had a house alarm. So imagine your nervous system is your house alarm. The alarm is there to protect us if someone breaks in through a window or a door. So that's a good system to have. Our nervous system should protect us if something actually dangerous happens to us, like we break our leg or we're in a car accident. That's a good system to have. What can happen goes a little haywire. Signals get crossed. So it would be like all of a sudden your house alarm started ringing, that alarm, that loud alarm bell started going off every time a fly landed on the outside of your house. Your nervous system becomes so hyper vigilant and overprotective that it starts to give you signals even when maybe they're not warranted. So I just want to give you a quick example because it's hard to believe that that could be true. So there's a famous study in the pain world that we often reference where people volunteered. They knew that they were coming in to volunteer as a study for pain. They were fitted with a helmet that had electrodes attached to their head. That was attached to a unit that was delivering current. They were in control of the knobs. When they turn the intensity up, intensity goes up, intensity down, intensity goes down. And then they were asked after to rate their pain according to when they turn the dial. And as you would expect, when they turn the intensity on the current up, they reported higher levels of pain. When they turned the intensity down, they reported lower levels of pain. But the kicker is the machine was never plugged in. There was absolutely no current coming into their bodies whatsoever, but the knowledge that they thought the current was going to be coming in was strong enough for their nervous system to give them that protective output of pain. And not only that, it was strong enough to change that output of pain according to the dial, even though the dial wasn't doing anything. So that's how powerfully our nervous system is tied into our experience of pain. And that's actually good news for us, because we used to think that all we could do to help people in pain was address the tissue, address the part that was damaged.
Okay.
Now we understand that, yes, that's a part of it, but we also have to address it on the side of the nervous system. So we have to use our mind and our thoughts to change what's happening in the physical body, and we need to use the physical body to change what's happening in the mind and the thoughts. The combination is what is the most powerful. And that's really empowering, because before, you sort of had no choice but to put yourself in the hands of a professional to help you with your situation.
Mm-hmm.
While you should still do that as an adjunct, now we understand there is so much that you can do for yourself that is very powerful. And you're the one who lives in your body 24 hours a day, 7 days a week. When you come to see me, I'm seeing you for an hour once a week. You're living with your body all the rest of that time. So if you can have some tools at your fingertips that you can use every day, that goes a long way. So it's kind of exciting, actually.
Exactly, and especially with the side effect of neuropathy. And a lot of people have neuropathy in their hands and their feet, and that's something that's very painful and hard to control. And, you know, some don't want to take medication and they want to do it naturally.
Hard.
Definitely. So would it be...
So I'm glad you brought that up. That's actually a good...
I lost you. She'll be back.
I can't hear you, Sandy.
Yeah, I think because you
Try
froze,
again.
we can hear you. There, we can hear you now. Yes.
Give me a thumbs up when you can hear me again.
Okay, we hear you. We can see you, Colleen, but we can't hear you now.
I got kicked out again. Am I back?
Oh, you're back now.
Can you hear me
Yeah.
now, Sandy?
Yes, we
Not
can hear
yet.
you. Yes.
How about now?
Yes.
Okay.
Yeah.
So I'm glad you brought up the aspect of medication, because that's something that's changed as well as we learn more about pain. We used to recommend to people, tolerate the pain as long as you can, and when you really can't stand it anymore, then you go to medication. We now understand. Can you still hear me? I'm getting a message that it's
No,
bad. Can you
I
hear me
can
okay,
still
Sandy?
hear you. Yes.
Yeah, okay, sorry. Now we understand, the more we can manage the pain, the less likely we're going to end up in a chronic, persistent state of pain. Because the problem is that our nervous system gets very good at whatever we do often. So if you're in pain a lot of the time and for a long time, your nervous system gets better and better at being in pain.
Okay.
The good news about that is that now that we understand neuroplasticity, we know that whatever the nervous system learns can be unlearned. So it's learned how to be good at being in pain. We can teach it how to no longer be in pain. Okay?
Yes.
So having said that, it's worthwhile sometimes to go ahead and use that medication in the short term to avoid long-term pain. It's not a failure. It's not a weakness. It's giving your system the chance so that you can use, if you decrease that intensity of the pain with your medication, then think about how much more energy and resources your system has to deal with the cancer or the side effects of your treatments or your injury, whatever you might be dealing with. So it's not a weakness at all to take that medication, is what we're understanding now.
Okay. Great.
Okay.
Thank you. Because it is definitely, so as I'm understanding is definitely with the whole person, you want to address exactly the pain that you have, and you may have to take certain medication, but it's also important to learn certain approaches, holistic approaches, to be able to help you with this side effect.
Yes, absolutely. So things
Okay.
like breath work, mindfulness practices, more and more research now is strongly supporting how much gratitude and self-compassion change our physiology. That just spending first thing in the morning when you wake up, have a journal at your bedside and you write 3 things that you're grateful for. You start your day with your physiology in a better state. And then last thing when you go to bed, you either write it down or you think of it or you say it out loud. Again, 1 to 3 things that you're grateful for. And again, it sets up our chemistry, our physiology to be in a better state. Self-compassion does the same thing. Kindness to others does the same thing. So it's not just through moving the body, although that is an important piece as well. We have to do both a top-down and a bottom-up approach. And it's the combination of the two that are key. And what studies have also shown is that the more we understand about how pain works, the less fear we have around it, because fear is one of the most limiting factors when we have pain. Because if you don't understand what's happening in your body, it becomes really challenging to do anything because you're so afraid that you're going to make things worse.
Mm-hmm.
So there are several studies that show that just giving people half an hour of pain education is enough for some to decrease the intensity of that pain. And that's without any other treatment whatsoever. Now, it's a much better result if we combine that education with things like breath work, mindfulness, and movement. The combination of all of those is what gives the best result. But it's interesting that just getting educated about how pain works already can decrease the intensity of the pain.
Okay. I often have a lot of questions of people who have been diagnosed with cancer but have metastatic to bones. And definitely if, doing yoga is very safe for them to do yoga? I always say that, start gently and then you will see your certain limits. But are there any yoga tools or anything for people, especially who have metastatic to bones?
Yeah, so in those cases, you have to be very careful, and I certainly wouldn't advise it unless the doctor has okayed it. Here again, it's very important that you work with the right person and understand that yoga and yoga therapy are very different. In that situation, I would work with a yoga therapist.
Okay.
And what I would suggest is go towards the other 7 limbs. Use the breath work, the meditation, the mindfulness, all of those aspects. And there are some gentle movements, of course, but it's not going to be the traditional yoga postures that are going to be what help people who have metastatic bone cancer. It would be too much. They would be too big. But there are many styles of gentle yoga. There's so much movements that we can do that are really small and subtle, but you have to have the right person who understands how to work with that.
Okay.
I wouldn't go to a yoga class, for example. I would really work one-on-one with someone if I was in that situation.
Okay. And is there any yoga tools that you would like to tell us or share with us that we could use when somebody has persistent pain to their bones or chronic pain to their bones?
So it's just specific to bones, or are we talking all?
Actually, maybe all, yes.
Yes, for sure. So we'll take a few minutes to do a practice. Is that okay?
Yes,
Yeah,
yes.
okay, perfect. Okay, so let's start with the breath practice. Breath is one of those things where it sounds so simplistic. People always think it can't possibly do as much as we say it does, but it truly is one of the most powerful tools that you have at your fingertips. It's something that you can use anytime, anywhere. It's a great thing to pay attention to when you're getting treatments. Although having said that, right now, if you're getting treatments and you're wearing a mask, that's a different story, because when you have a mask on, it's not the time to be doing a breath technique because you're putting out too much CO2 and you're getting that back in. So let's pretend we're talking about without a mask right now, okay? So I'll just invite you all to get into a comfortable position. If you want to change your position, go ahead and do that. If you prefer to be lying down, please go ahead and do that. Although it can be done standing and seated if you're out and about, but for today, take the time to get comfortable. So we're going to do 3 different breath practices here. The first one, I'm going to invite you to put a hand on your breastbone, also known as your sternum. You can put 1 or 2 hands. I like to do 2, but it's your choice. Can you see my hands here? So as we breathe in, imagine my hand is my sternum, okay? As we breathe in, we want to use our breath to puff the bone a little bit away from the spine and a little bit towards the face. I'm exaggerating it a lot just so you can see it. And as we exhale, it should sink in towards the spine and slide a little bit towards the floor, okay? So that was an exaggeration of it. It's going to be much smaller than what I just showed you. So you're going to breathe in and out through the nose at your comfortable rhythm. So a nice, long, slow, smooth inhale. And a nice, long, slow, smooth exhale. You keep going at your rhythm and just notice what's happening under your hands. Eyes open or closed, whichever way brings you more into connection with your body. Just first check in, do you feel any movement under there? And for many people, maybe you don't, because it's a common area to have tension. See if as you go along with these breaths, can you start to pick up on a little bit of movement under there? And that will happen over time. The more often you do this practice, the more movement you'll gain there, the more freedom you'll gain there. Especially on the exhales, over time, you want to feel like that breastbone sinks further in towards the spine. The more tension that we hold in those tissues under there, the more prone we're going to be to feeling anxiety. This is also a breath that you can use when you're feeling that nausea, because the vagus nerve, which goes from the brain, exits behind the ears, it passes down between the lungs and heart. That's the one that makes us feel nausea, and it can get trapped in that tissue. So gently doing this breath practice is a nice way that can sometimes soothe that nausea. Let's do 1 more breath here. And gently let the hands go. The second one, I'm going to ask you to place your hands on the outside of your lower ribs. So you can either be like this, or if that's hard for your wrists, you can put the backs of your hands on the side of the rib cage. Okay. So where the first one, we put our focus on having the breath higher up in the chest. This time, I want you to send all of your breath lower down into your lower rib cage. So that as you breathe in, you want to feel your ribs get wider out to the sides. As you breathe out, you want to feel the ribs narrow in towards the center. So go ahead at your rhythm. Long, slow, smooth, and soft is the key. And you want to try to feel that expansion on the inhale, that retraction on the exhale, and it's that rhythmic opening and closing of the ribs that is really helpful for us. This one also can help with the nausea because that same vagus nerve goes right through the muscle of the diaphragm. And this movement of the rib cage helps to get this up and down movement of the diaphragm, pardon me, which will help to get some pressure off of that vagus nerve, which can help with nausea. Last breath like this. And let that go. And then the last one we'll do together now, I'll just come up a little higher. You're going to place one hand at your solar plexus, one hand at the same level at your back. If you can't reach at the back, you can just have the pressure of your body against the back of your chair to give you that feedback. So the previous one, we were thinking about expanding out to the sides. This one, we're going to think about expanding front and back. So it would be as though you have a balloon between those two hands. On your inhales, you want to fill that imaginary balloon so that your two hands get pushed away from each other, front and back. And on your exhales, they spin in towards each other. So the front and back hand get closer to the spine as you exhale. Always going with long, slow, smooth, soft breaths. Instead of a deep inhale, you want to think of long, slow, smooth, and soft. One last time like that. And gently let that go. I wonder, Sandy, if anybody has any questions on those before we move on. I'm happy to answer.
Somebody was asking these exercises that we were doing at the beginning, way at the beginning.
Yes.
What were they for exactly?
Okay, so they were for what we call vagal tone. Vagal tone is something that also in the last few years, the research on it has exploded, and we're understanding how big an impact vagal tone has on our health in all senses of the word. So the vagus nerve comes from the brain on both sides. It exits just behind the ears. It has branches to the palate, the tongue, the throat, the heart and the lungs. It goes through the diaphragm, and it supplies the entire digestive system. So this is the nerve. If you're feeling nausea, your vagus nerve is mad. Okay? Vagal tone is the ability to go from a sympathetic, which is our fight, flight, freeze state, to a parasympathetic, rest, digest, and repair state. Having good vagal tone means that, okay, I'm in that fight mode when I have to be, but when the danger's gone, I quickly recover into that rest, digest, repair state. If you have poor vagal tone, then after that fight, flight state, you have a hard time coming back down. And if we stay up in that fight state, we cannot heal. We can't be doing the two at the same time. If you're in fight mode, you're not in healing mode. So strengthening your vagal tone is a fabulous and efficient way of going from that fight mode, which we need to have sometimes, into that repair mode. Some other excellent and very simple ways of strengthening vagal tone are gargling. So they say to gargle for 5 minutes a day because it stimulates the vagus nerve in the area of the throat, tongue, and palate. Humming, singing, and chanting. So those are all things that we can do very easily. For me, if I'm ever feeling road rage in my car, one of the other things that's a bit of a challenge right now because of COVID is seeing someone face to face. It happens a little bit through Zoom. It's better like this than to be on the phone with someone because we can actually see each other's facial expressions.
Right.
Seeing a kind expression on someone else's face is a very good way of calming that vagal system, of strengthening our vagal tone. So if you have a pet, looking at your in the eyes, petting them is also a good way of strengthening vagal tone. Skin to skin contact with another human, so holding hands or cuddling is another way of strengthening vagal tone. So they're all very simple things that we can incorporate. Did that answer the question that someone had? So the reason this one works is because the area that the vagus nerve leaves the skull is between two bones, the occiput and the temporal bone. That movement we just did, it stretches that space, that hole that the vagus nerve comes through. So if there's any compression on the vagus nerve, it makes it hard for it to have good tone. That exercise that we did, which is so simple, it gives it more space so that it's not being compressed. Very similar to if ever you've ever experienced sciatic nerve pain. Oftentimes it's because a muscle in your bum is tight and it's squeezing that sciatic nerve, so it's making it angry. Same thing can happen with the vagus nerve anywhere along its path, and it happens to be the longest nerve in the body. So there are many ways, many areas that it can get sticky, if you will. So those 3 breaths that we just did all help to unstick the vagus nerve, and that first one we did also helps to unstick the vagus nerve from different parts along its path. Did that answer the question?
Yes, so which is great actually. So these, like the balance being safe at home, and these are movements that can be done very often at home and safe.
They're so safe. Exactly. These are ones that don't have any negative to them. They're either going to change nothing or they're going to help. They're not going to make anything worse. There's no detriment to doing these ones.
And it's good.
And one other thing I should point out about the vagus nerve, it's newer information again. So it's like a two-way highway. Information goes from where it exits the brain down to where it feeds the digestive system, and information comes up towards the brain. We used to think that it was more the brain dictating what happens in the gut. We now know that around 85% of the signals between the two actually go from the gut to the brain. So let's say, for example, you have constipation, diarrhea as side effects from some of your treatments.
Yes.
Over time, that creates an irritation along the vagus nerve up this way, which can then cause symptoms of anxiety or headaches, brain fog, cognitive issues that sometimes we can't figure out why we have these, auditory issues, visual issues. Sometimes that irritation down at the gut is sending all that irritation up the pathway along the vagus nerve and affecting things way up here. All the tricks that I just gave you can help with all of that.
That's positive. That's positive. That's something I am going to use at my work.
Exciting. I find it so exciting because they're so simple, but they really, really work. And you could do those as you're at the hospital getting treatment. You know, those are very simple to do wherever you might be.
Exactly.
And in your, if you're someone who gets anxious about your treatments or about, I would imagine that one of the toughest things is when you have to go for that follow-up scan and you're waiting to hear if it's positive or not. And so that anxiety that you're feeling on the drive to that appointment, sing in the car, hum in the car, and calm that vagus system down so that by the time you get there, you're not ready to blow. Does that make sense?
Yes. Because I had somebody who was saying that during their chemotherapy, when they were sitting in the chair in the hospital, it's difficult sometimes though, but you really have to meditate, like do yoga therapy, because you're also interrupted sometimes from the pivot nurse who comes or the doctor comes or the noise around. But definitely I've had somebody who was doing it in the waiting room before to prepare when the noise is around, that when she goes through chemotherapy, and it was very, very helpful.
Absolutely. And that's where the breath, even if you're not doing a specific breath technique necessarily, which you can do, but maybe there's so much going on that that's challenging. Just using your breath as an anchor, we call it, so that it brings you to inside your body, to a calm place within you, rather than being pulled to all that chaos that's around you on the outside. If you can figure out how to use your breath, I like to call it as your own lullaby. The sound and the rhythm of your breath is like your personal lullaby that you sing to yourself, that you soothe yourself with. So if you can just tap into that while you're in those chaotic, distracting moments, it can be very, very helpful. And again, keeps you in that parasympathetic state so that you can heal rather than taking you into that fighting state, which is not what you need in that moment.
Thanks. So I see the time. I know that we passed, but we started a little later. So definitely, and there's another class at 1. If there's anybody who has questions,
Okay.
definitely you can write them in the chat. But I think also, Colleen, we had spoken about that maybe there's studies or evidence out there that osteopathy and yoga therapy is very, very good for cancer people. Do you have any links
Yes,
that
the
we
studies
could
mostly
share?
show that it's, I will send you some for sure. Can I share one more thing with you guys before we sign off, Sandy? Yes.
Definitely.
So one of the challenging things for people when they're in pain or when they're not feeling well is getting back to movement and how to get back to movement safely. And although there are no recipes when it comes to the human body, because everyone is so unique, this is the closest I will give you to a recipe, okay? So there are 4 things. One is you have to challenge it to change it. If we never challenge our tissues, they can never change. So think of if there's a movement you're afraid of and you never ever try that movement, you're guaranteed to never be able to do that movement. So you do have to challenge things a little bit to get any sort of change. But how do you do that and stay safe? So there's 3 things that you can do to stay safe. You want to check in with your breath. So your breath is a perfect indicator. It's like a litmus test for your nervous system. If you start to do a particular movement and you check in with your breath and you notice that you were able to keep your breath long, slow, smooth, and soft, that's your nervous system's way of saying, I'm okay with this. I feel good about this movement. If on the other hand, your breath got short, fast, very shallow, or you held your breath, that's your nervous system going, oh, hold on, I'm not sure if we're ready for this. Doesn't mean that you have to stop. It means that you need to pause, see if you can get your breath back under control, and then try again. Second thing to check in with is your body tension. The other indication that your nervous system is thinking there might be danger, but remember the nervous system is not always right about danger, is that it'll tighten up certain muscles. So you can check in. And if there's anywhere that tightened up in anticipation of doing a new movement, you take a moment, you get your breath back long, slow, smooth, and soft. You take the time to release whatever muscle tension, and then you continue trying the movement. And the last step is you check in with your mind. If you've had negative experiences with movement in the past, it's likely that there's a whole story going on up there when you're about to try movement. Your brain is saying, oh my God, the last time I tried something like this, I ended up in bed for 3 days, so I don't want to do this. So you have to change the story. We know now that we can change literally the neuronal connections in our brain by changing our thoughts and changing our thinking. So you want to use a positive story to try to calm down the negative story that might be running on a loop in there. So I'll just review that really quickly. When you're trying movement for the first time or you're trying a new movement, check in with your breath, check in with your body tension, and check in with your mind. I hope that's helpful because it really works.
Definitely. Yes, definitely. Okay. I think that I don't see anybody asking some questions. I think that I didn't know if there's anything else or if you want to do a little movements before we leave.
I certainly could, if you guys would like to do one more. It maybe in the chat, can you guys tell me what is the #1 thing you'd like a practice that would help? Is it nausea? Is it anxiety? Is it, if everyone could take a moment to just do that real quick, and then I'll choose the practice that's most appropriate for what you're saying. Thank you, Natalie. While you're doing that, I'll let you know that I'm in the process of putting together that Discover to Recover program, which goes into much more detail of all these pain neuroscience concepts and gives you tons and tons of very short, easy to use practices. I'm hoping that it'll be ready in a month or so I can keep you posted. Just good old pain, okay? Yeah. Let me see if I see the others.
Seems to be joint pain and knees.
Joint pain.
Yeah.
Okay.
Actually getting off of
Okay, you know what we're going to finish with then? Okay, this is what we'll do then. We're going to do a lymphatic one. Do I have 5 minutes, Sandy?
Definitely, yes.
Yes? Okay. Okay, great. So anxiety and tension. Okay. The lymphatic system is really important in healing. I'm sure you've heard the lymphatic system talked about with your cancer treatments. If the lymphatic system is not moving, then we can't get rid of what's no longer necessary and things get stagnant. So getting the lymphatic system moving is very important. I'm actually going to take this off. You can do this seated or standing. It's a fabulous thing to do first thing upon waking. If you find that you're really sluggish when you wake up, you don't have that energy to get up and go, or you can use this any time of the day where you have that energy dip, okay? So we're going to basically be giving ourselves a self-massage to stimulate the lymphatic system where all the breath work was very slow and soft. This is going to be stimulating. We want to use short, quick movements, okay? So we're going to start at the head. You're going to use your fingertips and you're going to brush along your scalp. Go ahead and do it with me, everybody. And you're going to do short, quick movements. You're trying to wake things up. So don't be too slow. Don't be too soft with this one. You want to shake things up a little bit. And then you're going to get to the throat and you're going to be stroking down and go all across the front and sides. My wires are getting in the way a little bit, but get the whole thing. And then when you get to the back, you're going to do like a circular massage from the base of the skull all the way down, keeping it quick. We're wanting to wake up the system. Then when we get to the sternum, we're going to tap with our fingertips. You're going to go down and up the sternum a few times. You're tapping with those fingertips. We're waking it up. And then you start to go out along the rib cage and back in and go down a little bit, and we'll do all the ribs. So you're going to go, if you've got breasts, you can lift them up to go underneath and get around to the sides as far as you can reach. At the shoulder, we're going to circle, and then along the arm, we're going to brush with long strokes on every part. At the elbow, we circle. At the forearm, long strokes, every part. At the wrist, we circle. At the hands, long strokes. Take each finger, pull and snap, pull and snap. Like you're trying to throw away all the gunk. Other side, shoulder, we go round at the joint and then long strokes along the whole arm. Around at the elbow joint, long strokes at the forearm. Around at the wrist joint, long strokes along the hand, and then every single finger, drag and snap. You're getting rid of all the gunk. At the abdomen, you're going to do a circular motion at the solar plexus and take that down. I'm not going to be able to show you, but take that down to the groin. If you're seated, point your legs to the outside so that you can rub along the inner thighs. And then long strokes along the front of your thighs, side of your thighs, backs of your thighs. Circle around the knees. Long strokes along the shins, front, side, and back. If you cannot reach your lower legs, instead you're going to pump the feet, point and flex the feet instead of doing what I'm saying, okay? Circles at the ankles. Rub along the feet just like we did along the hands. And if you can't reach the feet, you're just going to point and flex. And then just like you do with the fingers at the toes, you drag and throw it away. But if you can't reach, you're curling and reaching. Same thing with the other leg, other foot, I should say. So long strokes at the foot itself, and then pull and snap at each toe. Come back to sitting with both feet on the floor, and we're going to finish with a breath practice to stimulate the lymphatic system as well. So this one, I'll demonstrate it first. We're going to take an inhale to fill the belly, and then we're going to use the sound of shh, like you're shushing someone, to draw your belly button in and up. And we're doing that to squeeze the lymphatic system right at the solar plexus. Okay, so nice long breath in. And then again, you go ahead at your own rhythm. If I'm breathing faster or slower than you, like you're trying to scoop the belly in and up. One last time, breath in. And then eyes closed for a moment, and just notice, you might feel that you've got sort of a buzzing going on in your body, that maybe you're ready to get up and go tackle a task right now because you've got a little bit of energy. And then gently open the eyes. Any questions on that one? So that's to stimulate the lymphatic system. Great to do first thing in the morning, great to do for joint pain, great to do for headaches, and great to do if you get that energy dip at any point in your day.
Perfect. Thank you so much, Colleen. I know our time is going.
My pleasure.
We didn't have any other questions, but definitely thank you very much. It was a very interesting and a lot of information to take. And for myself, actually, to even share with the participants at our wellness center. Thank you so very
Wonderful.
much. If anybody's interested,
and if anyone has questions later, they can email me.
Anybody want Colleen's email, want some questions in that, please, you can forward that to me. I think that's it.
Thank you so much, everyone. Thanks for taking the time. I hope it was helpful for you.